you in person very soon. So yay.
Thank you.
All
Thank
right. Good morning, good morning, good morning, good afternoon, good evening, depending on when and where you're watching this Facebook Live. This is the voice and the face of Dr. Tolu Olabintan of Living Spring Family Medical Center here in the awesome city of Mansfield, Texas. We're here again with another Facebook Live, all in the hopes of helping you live long and well because we believe the quality of life is just as important as the quantity of life. If you're watching live, hashtag live. If you're watching replay, hashtag replay, tag people forward, and invite your friends to join because today we'll be talking about, Doc, I have HPV. What that mean? What does that mean? Okay. And I'm excited and honored to have Dr. Taiwo Durowade joining us today. Thank you, Doc, for coming. How are you?
Thank you. Thank you for having me. I'm good. How are you?
I am good. It's another Saturday morning. Whew. Uh, all right. So, just real briefly, Dr. Taiwo Durowade is a board certified OB-GYN. So she's an obstetrician and a gynecologist, and she's been practicing in Chicago for the past 5 years. She's also the owner and the founder of her own private practice, gynecologic practice, that started January of last year, and it's called Dardur Gynecology. Now, I will also say this about Dr. Durowade. I enjoy watching her videos
Oh, thank
and,
you.
and her YouTube channel because she's a big fan of educating her patients, and that's why she created a show called On Common Knowledge on her YouTube channel, where she actually shares information that should be common but remains uncommon with her viewers and her subscribers. So I would encourage you, and we'll have that information by the end of the show so you can connect with her. Now, little tips about her. I know you're seeing her. She enjoys traveling. She enjoys spending time with her family, and she likes watching K drama.
I do.
my little thing is that Bollywood. I love Indian.
Oh, so Indian dramas.
Ooh, I love Indian dramas. Especially the old school ones. Shah Rukh Khan
Okay,
and them
okay.
people. But thank you so much for coming, and it's
Absolutely.
so awesome to have you here. Now that being said, my question to you is there anything else you want to share with our viewers as to who you are and what you do and why you do what you do?
Thank you again for having me this beautiful day. I really I'm honored to be invited to be on your platform. I know how important this is because of your mission and your practice. My practice, my passion in life is to educate people, and for them to live well and to live long, they need to be well informed. So when I'm, I find that I'm explaining a lot I'm teaching my patients.
Mm,
And
mhm.
so I would encourage anyone out there to find a doctor that would explain to them, that would teach them, that will help them feel like they know what's going on, so that when they're taking the medications, they know why. And people don't just stop taking meds because they just gave me meds. So my mission, passion, goal, mission statement is educate my patients, educate your viewers, your patients, so they can live healthier lives. So
Awesome. I
my
love what you do, Doc, and I
thank
appreciate you
you.
giving that feedback. All right, so let's
Thank
try, let's dig right into it. So, but we didn't answer this question though. Why do you do what you do?
you.
Why?
I guess for me, and for my practice, I'm an OBGYN by training. Um, but I chose to focus on just gynecology. And if it's okay to be honest here,
It is.
um, the OB part, where you're on labor and delivery, you're running around, you're trying to deliver a baby, it makes me very anxious. I
Mm,
become very, I do it very well. A lot of people are asking me to be their OB, but it's after all that, anxiety and stuff, it's a lot to recover from. So I decided that I wanted to focus just on the gynecology part,
mm,
where I can sit down, I can talk to my patients, we can come
mm,
up with a plan
mm,
together. And so I chose gynecology because I enjoy education, I enjoy surgery, I enjoy interacting with the patient just beyond the pregnancy and the delivery. And there's less anxiety involved. So that's why I do
love
it.
it, love it, love it. I'm thankful that you do what you do
Thank you.
because there's a big need for it too.
Mm.
Now, let's get right to our topic. We're talking HPV. for those who are watching it, like, what is that? What is HPV? I hear pap smear and stuff. What is HPV, doc? What would you say?
HPV is called the human papillomavirus. So it only infects human beings. So this is the only type, this particular virus. That's why it's tagged human. So there are probably other papillomaviruses, but this particular one is human papillomavirus. There's so many different strains of it, over 200 different strains of it. There are the low risk strains and the high risk strains. We worry about both strains, but the biggest ones we worry about are the high risk strains because we've seen those high risk strains come out of cervix cancer. So that's why we care about HPV. Whenever I see my patients for a pap smear, I ask them if they know what a pap smear is. And most people think a pap smear is just looking inside the pelvic, like doing a pelvic exam.
Right.
And I have to reorient them and tell them that a pelvic exam involves just a pap smear. We're looking at the vaginal walls, we're looking at the external private area, and then we're looking at the cervix, which is the part of the lower part of the uterus. And then we take the pap test from the cervix because we want to check the cells on the surface of the cervix to make sure those cells are normal. So that's the pap smear. And we test those cells for HPV to see if that cervix has an increased chance of cervix cancer.
Awesome.
Yeah, so HPV is a virus. It's sexually transmitted, so you can only get it through the high risk ones through sexual contact. And it is, we care about it because it can cause cervix and vaginal and private area cancer.
Cancer. Okay. Awesome. I like that you differentiate the high risk and the low risk. So there are many of them, but we test for the ones typically that are more high risk because they are the ones that tend to lead to cervical cancer. And I love how you explain that a pap smear is one part of a GYN exam or part of your well woman exam.
Correct.
So people don't assume now that pap smears are every 3 years. I don't have to do a wellness exam. It's 3 years. It's
exactly
really awesome. So you answered the next question already, but I wanted you to emphasize it. How do you get it, and how do you prevent it?
Good question. So HPV can be very frustrating in that it is sexually transmitted. So the only way HPV transmitted is from skin to skin contact. So some people say, well, I use condoms all the time. How did I get this? It's because condoms may not protect the skin area that is in contact with that other person. Because it's not just the private parts that are in contact, it is the whole body that's in contact during sexual intercourse. So I always tell my patients that skin to skin contact. So even if you use protection all the time, it's not 100% foolproof that you will not get HPV. To prevent it, we would say, limit yourself to one sexual partner. So monogamous relationships. We find that even then, it's the most commonly transmitted disease actually in the United States. It's the most commonly sexually transmitted disease in the US. So it's very ubiquitous. Almost everybody has it. Not everyone, but almost everybody has it. So at one point or the other in someone's sexual history, they've come in contact with HPV. How to prevent it basically is by vaccination. So since condoms are not foolproof, we tell our patients that it's a viral infection. Your body sees a virus, your body will make antibodies and fight it off. So if I give you the vaccine ahead of time before you're exposed, then your body can recognize it faster and clear it out of your body faster. HPV infections are usually transient. Like when you get in contact with HPV does not mean it stays with you forever. Your body will fight it off. We start caring about it when you're exposed to HPV persistently, and so the virus doesn't clear, or you're exposed to different kinds. And then even though you cleared one before, the next partner has a different strain, and then you're infected again. So vaccination helps us to cover that so that no matter what, we cover at least 9 out of all the 40 high risk that we have. I apologize, 15 high risk that we have. We're able to cover 9. So the vaccine can help you cover most. And so that you can fight it off and it doesn't stick around. because when it sticks around is when it has the chance to cause cancer.
Cause problems. Okay, so it's all about risk prevention or risk
Correct.
reduction, right? So
Correct.
you reduce the risk, practicing safe sex,
Yes.
condoms still used, even though it's not 100%, and then vaccinations are very, very important. Now, I'm
Exactly.
going to ask a unique question because I get this a lot, in discussing, with patients who are like, oh, my partner gave this to me. I'm done with him. Oh my God, I've been married. I trusted. So
Mhm.
let's talk like how soon, like if once somebody is diagnosed with HPV, can they say that, oh my goodness, my partner gave it to me. I've been with him. I got married a year ago. And he gave it to me. And like let's talk a little bit about that. Like why is HPV a little bit of a conundrum?
Mhm. That's a great question because I have this conversation almost every day. People are wondering, when did I get it? How long has it been there? Is it this partner or my partner 20 years ago? There's no way to know. There's no way to know. Well, there's one way to know. If you had a normal pap smear 3 years ago and you've only had one partner since then, and you get HPV now, it is highly likely that it is from this partner. But HPV can also be latent. It can calm down and not activate, and then something happens, it reactivates. So it may not be from this current partner, it may be from your previous partner. So there's really no way to pinpoint unless somebody has never been sexually active and then suddenly becomes sexually active with one partner and then tests positive for HPV. Then you can pinpoint it down. But in someone's sexual life history, it might be difficult to say this is when you got it. What's frustrating about it is that, like we said, um, you know, people ask me, so I have to go back and be sexually active with my partner. I mean, am I gonna keep getting it? The answer is you're going to keep being exposed to it. Our
Hmm.
job at that point is now to make sure that this HPV is cleared from your body. So by boosting your immune system, you know, multivitamins, vaccination, so that even if you continue to be exposed to it, we can reduce your risk of it sticking around, of it becoming persistent. And if we start seeing any changes in someone with HPV, we would check you sooner. More frequently,
Hmm.
so that if it starts causing abnormal changes that we're concerned about, we can go after it and disrupt the process.
Okay, so you talked about vaccines.
Right. Just to touch a little bit, from HPV infection to cancer, it takes about 20 years. So it's
Okay.
not that somebody got HPV today and suddenly their risk of cancer is up and they're going to have cancer in a year or two. No, it takes about 20 years. That's why we say that nobody should die of cervix cancer. Nobody should be having advanced stage cervical cancer in this day and age, because we have enough um, preventive options.
Hmm.
We do your pap smear regularly. If we see any signs, we do biopsies. If there are abnormal biopsies, we take off the surface of that cervix that's infected and allow a new cervix to heal. So there are many processes involved within that 20-year period to interrupt that HPV process. So even if your partner has it and you have to be with your partner forever, it doesn't mean that you're going to have cancer. It just means we have to keep a closer eye on you because your risk of exposure to HPV is higher.
Okay.
The vaccine, like you said, the vaccine is a 3-shot series. We recommend the 9-valent vaccine, meaning it covers 9 of those high-risk viruses. It also covers 2 low-risk viruses too. And I'd like to touch on the low risk if we have a little bit of time. So 611, 16, 18, and then a couple other high-risk strains. So we give it to you in 3 shots. If you get one today, your next one is in 2 months, and then
Mhm.
your next one is 6 months after the first shot. There are even people who only get that one shot. Research has shown that they actually have risk reduction, that it works. Even if it's just one dose they're able to get. If you miss one dose, let's say you got one dose when you were 15, 16, and then now you're 34, you can complete it. You don't have to start over. We can just give you your second dose and then give you your next dose 6 months later. So you can always finish the series. And
Mm.
now, ACOG, American College of Obstetrics and Gynecologists, they have approved the vaccine up to age 45. So
Yes.
I've given my 41, 42-year-olds vaccinations to reduce their risk of other kinds of HPV, because it's possible that someone has more than one strain, you know? And even if you've been exposed to one and you're fighting off one, we want to protect you from the other ones that you may possibly be
Yes,
exposed to.
that's true.
So that's why people say, well, why get the vaccine now? I'm already Well, because there are 14 other kinds that you could be exposed to, and there could be 14 other types that are latent. So sometimes it's quiet. Sometimes it's
Mm.
quiet, it's not active, and when you're older, your immune system is down, it reactivates, and so we want to protect you from those ones as well.
Yes, and also important to encourage your partners to get vaccinated too, because they're the
Absolutely,
source of
yeah.
the exposure. So that's
Yeah, so
another.
the partner can clear it also, and then
Yeah,
reduce your risk of keep being
exactly,
exposed to it. Yes,
exactly.
thank you for that.
No problem. Now, for someone who's out wondering, okay, when should I start getting tested for this? What would you say, Doc?
Mm,
When should I start?
great question. So evidence shows that within 10 years of someone's sexual debut, like when they first start having
Sexual
intercourse, is
debut.
when they'll be. That's how the research
Debut.
the
Okay.
research documents put it, to be politically correct. Um, Within 10 years of sexual exposure. Now, we used to do pap smears on women who were 18, 19, and we were finding that we were having to do procedures on their cervix.
Mm,
And those procedures sometimes can cause issues later in life for them for childbearing. And so we found that HPV infection, like I said at the beginning, is transient. Most of the time, your body will fight it off. Your
mm,
immune system will see the virus, create antibodies, fight it off. Um, and so those 18, 19-year-olds, 20-year-olds, or just early young women whose immune systems are very strong, we don't do anything. We don't test them until age 21
okay.
because we don't want to be operating on 18, 19-year-old cervices. We want to protect their future fertility. But at 21 is when we collect the pap, but we don't test for HPV. We only test for HPV if the pap is abnormal. So because we know even if they have HPV, they'll clear it from their bodies. So we just do a regular pap smear, which is just get the cells and look and see if they're normal. And if they're normal, we let her go on her way. We teach her about safe sex, let her go on her way. By the time she turns 25, we start testing for HPV if the pap is abnormal. So reflex HPV. Because then we know that from first sexual experience to HPV can take 10 to 20 years. We want to start catching those abnormal cells between age 25 and above. Because on average in the United States, most girls become sexually active around age 15. So around age 25 is when we want to catch abnormalities and interrupt the process and not allow them to be 35 and getting cervix cancer. Am
True.
I making sense? And
Yes.
then after age 30, we test every pap with HPV. So even if the pap is normal but there's HPV present, we're watching that lady like a hawk because we know that HPV can act up at any time.
That is true. A lot of useful information here. And so I kind of want to wrap it up because we already talked about, how to test for it, when we should start
Mhm,
testing for it, how people get it.
mhm,
Now, let's say someone who's watching who's like kind of befuddled and like, oh my goodness, doc, I was diagnosed with HPV.
mm,
What would you say to that person? Like, what should I do? What are my next steps? I did a pap smear. They found I was HPV. I am 30. Let's say I'm in my 30s. Do I need to tell my partner that this is like an
mm.
STD
Great
that
question.
needs to be like we can't get together no more? Like what does that mean? Because I'm nervous and I don't want to not tell him, you know, I have an STD. Like what would you say to that person?
That's a great question and a very complex
Yeah.
discussion. I always tell my patients, and I always advise them if you want me as a physician to explain this to your partner, I'd be happy to. That way you guys can answer all your questions and feel reassured. But yes, you have to inform your partner and let them know that it is a virus. It is a sexually transmitted virus that can be transient, that but can also be persistent and can also cause cancer. Now, there's no way to test men for HPV. We still don't know how. But HPV has been known to cause penile cancers as well. So, cancer of the private part of the man, of the genitals of the man as well. So, it is important for your partner to know about it. So, you should, it's not something that you should hide or keep to yourself. You want to share that information so that he can also be watchful uh,
Mm,
and looking for any signs that they should be concerned about. It's not as common, it's actually quite uncommon for that to happen. Um, More likely, the low risk ones, the genital warts, are the ones that are very, very likely to be transmitted
Mm-hmm.
to men. And you can, if you see warts on their genitals, they have HPV. And I always tell my ladies, if you see warts, do not engage with that person. Do not have sex with that person. Turn the lights on. Don't have sex in the dark. That's what I always tell them, because you never know. And then when the lights come on, you've engaged and you see these lesions on the person. They're not skin tags. I hear this all the time. They're not skin tags. Skin tags do not happen on the genital area. They're most likely warts, and you should stay away until those are clear, because HPV is from skin to skin contact. So I would say have that conversation. Let them know that it is an infection that can be cleared by the immune system, an infection that you both can clear by getting vaccinated,
Mm-hmm.
an infection that can be low risk or high risk. And as long as the infection is cleared, it is completely safe for you and your partner to engage together. Um, it will create some complex conversations, but talking with your doctor actually helps, because then you might not be able to explain it to your partner the way the doctor would, and you would get more reassured the more you learn about the virus and how it works, so that you won't be afraid to be together.
Yes. And of course, these are medical suggestions. It's important to kind of make, to make an appointment with your own doctor to have these
Absolutely.
discussions. And I would strongly encourage you to find a doctor who's willing to have conversations with you and your partner over an office visit to discuss and answer questions, because these things are often life changing, or can be if
Absolutely.
not addressed properly. Um,
Absolutely.
I want to highlight something you said. Turn
Hmm.
on the light. Do an inspection. Yeah, because I've had people say, "Oh, he said he was a skin tag. He said it was a bump he had for a long time. If anything looks bumpity bump, anything, yeah, you step back. You step. That's very very important, because sometimes tough conversations result from that careless act. So
Mm.
please please please, I love it. Turn on the light.
Yes.
Love is blind, but open your eyes. Open, no, open your eyes so you can see, so you can reverse the blindness, because it's very
Right.
on
Hmm.
serious note. But this
Hmm.
has been very informative. This has been
Oh,
very
thank you.
engaging. I really appreciate you.
Thank you.
And I'm excited for those who are going to watch this, because this will help answer a lot of questions and actually
Mm.
help them be better advocates for themselves and say, I saw this on the YouTube channel where two
Mhm.
doctors were talking about this. Doctor, what do you think? What are my options and things like that? So this has been
Mhm.
great. Thank you so much for coming.
Thank you for having me. This was a fun conversation.
Awesome, awesome. So now that being said, I have people who are watching who are like, I'm in the Chicago area. I
Mm.
know people in that area and I want to send them to her. Or they're saying, I want her to come answer questions on the platform and come speak at a
Mm.
program. What would you say? Where can people find you, Doc?
Oh, thank you for that. I am on Facebook as Dardur Gynecology, or you can just search for my name, Dr. Taiwo Durowade. I'm on Instagram as the same, Dr. Taiwo Durowade or Dardur Gynecology. I'm on YouTube with an Uncommon Knowledge series. It's a YouTube series about educating my patients what I think is common, but is not really common, that I want them to know. And my office is located in Homewood, Illinois. Homewood, as in your home and a piece of wood.
Yes.
And it is in the south suburbs of Chicago, so maybe about 45 minutes from the city of Chicago. It's a nice little town. We have a great staff, all women, and so we're very intimate. We love what we do. We enjoy being together. I'd be happy to see you in my office for a consultation. I do video visits as well. So if someone who lives far away and wants to have a consultation first by video before making the trip down, that's available at my clinic as well.
Awesome, awesome. And I have people who do that, who check you out through a televisit first, and
Yeah,
then
yeah, yeah.
do the vibes, and then decide, you
And
know
then they
what,
come in.
I'll come see you. So that's a good way to kind of introduce yourself. I think
Yes.
that's a good thing to highlight.
Yeah.
And what we're going to do, we're going to have all that information put
Thank you.
here so people can connect with you after this is done. But thank you so much for coming. I
Thank you.
appreciate you.
Thank
Okay.
you for having me. This was fun.
All right, awesome. And thank you all for watching. I'm sorry I can't see who's watching, but thank you for joining live. Please share, like we said. And if you or anyone you know is looking for an awesome, a thorough, a passionate family physician
Oh,
in the
yes.
Mansfield, Texas area who would engage in conversations to help you live
Mhm.
long and well, I am she. Have a good one, everyone. Happy Saturday.
Thank you.
All